leadership to decrease the burden of cancer. So let's welcome Star.
Hello, everybody. I know we have a few people still taking a few more minutes of break, and that's totally fine because I need to switch slides here. What's that saying that if you're a jack of all trades, you're a master of none? I think I have slideshows down to a science now, at least switching the screens. But keeping track of everything, there we go. The clicker, that's what I needed. Okay, so as Jessica mentioned, my name is Star Jones and I'm the Wyoming Cancer, Cancer and Chronic Disease Prevention Unit Manager. So my title just changed recently, so forgive me that I don't have it memorized yet. It's a long title. I'd also like to introduce James Ruby. He is the new Screening Program Supervisor at the Department of Health. So everybody wave to James. This is his first in-person YCC meeting. So if you have any questions about the cancer screening programs, feel free to stop by and introduce yourself to James. In your folders, you have this lovely little beautiful document called the Urine Review. We just got this back last week finalized, and so we were happy to be able to bring it to the coalition meeting today to talk to you a little bit about it. And I'm going to kind of tie some of that into my presentation today, so if you feel free to grab it out of your folder and follow along, that would be wonderful. I need a bigger desk space with all the materials I have to show. All right, so the Wyoming Cancer Program is located at the Department of Health, and we are broken up into 3 separate components. So the screening programs, which include breast, cervical, and colorectal cancer screenings. That program reimburses medical providers for cancer screenings that are provided to eligible residents in Wyoming. Oops, sorry, my mouse isn't working. The clicker. See, not a master of this after all. Okay, so the screening program includes clinical breast exams, mammograms, Pap tests, and at-home stool testing options, and colonoscopies for Wyoming residents. And then the second component is the comprehensive cancer control, which it facilitates more of the outreach side of the program. We facilitate the Wyoming Cancer Resource Services, commonly known as the WCRS, and also supports the Wyoming Cancer Coalition activities and the work outlined in the Wyoming Cancer Plan. And then lastly, we also house the Indoor Radon Grant, which covers free radon test kits for Wyoming residents. Okay, so the screening program, like I mentioned, it reimburses medical providers for services that they provide to enrolled clients throughout Wyoming. And we do serve the population at 250% or below federal poverty guidelines. And then there is different risk and age criteria for each screening program. So we've kind of just made it very easy and said they must meet the risk and age criteria, and we will determine that once we receive an application at the Department of Health. So all you have to know is if they need a breast, cervical, or colorectal cancer screening, have them fill out an application and we'll do the rest. So during COVID, the program really focused on making some changes internally that would better support Wyoming residents so that when we were able to return back to the normal life, we'd be ready. 2 key changes that we made were the expansion of the breast and cervical cancer screening program to now cover the underinsured population. So before, we were only able to serve anyone who did not have insurance coverage at all, but now we are able to serve anyone as long as they meet the other criteria. So underinsured, we define it as having any out-of-pocket expense that would prohibit them from getting a screening. So we don't put a cap on it. We don't put a spending limit. It's anything that would cause them a burden. And then additionally, the pilot of the Fit Kit program ended in 2021, and we were able to use, or in 2020, and we were able to use the data from that pilot project to change the colorectal program rules to include at-home stool-based testing options as a covered screening. So prior to that, we were only able to cover colonoscopies. Those changes went into effect July 1st of 2021, and we are excited to see that the number of clients we're able to enroll into the programs has increased, and the services that we're being able to offer to Wyoming is definitely going up. So this is a graph that's in the year in review document. Last year, the screening program served just under 1,000 Wyoming residents, and this slide represents the number of cancers that we detected in the screening program alone. This is the FitKit pilot project. And so I mentioned that the pilot ended, and we were able to use this data to change the colorectal program rules. So this graph represents the data throughout that entire 5-year grant cycle. On here is 6 years worth of data because we actually had extra kits that we were able to keep it going after the funding ended. The blue line represents the number of returned fit kits. And I just wanted to brag for just a moment here that the National CDC funded colorectal program reports an average return rate of 31%. And as you can see for Wyoming's Fit Kit program, we maintained around a 60% return rate throughout the entire duration of our Fit Kit project. So that number is here, 60.5%. Out of the number of kits that were returned, 18% of those came back as positive or having some kind of indication that they may have some colorectal cancers going on and that they needed further testing. That number is a little bit high. We would like to see 8 to 12% positive rate, but we did determine that some fit kits were given to people that were having symptoms, and that may have impacted the number of positives that we received. After some training, actually, I'll go back to this slide to show you that there's a dip in 2020, and that was when we provided some technical assistance to providers on who to give fit kits to. So we feel that that may have resolved the issue there. And out of the clients who did test positive, we recommended that all of them receive a colonoscopy, and 59 of those clients actually tested through the screening program. So the rest of those screened through their regular insurance or another way, but 59% or 59 of those, or 22%, screened through the program directly. So another project that I'd like to touch on is a partnership with Wyoming Breast Cancer Initiative. So in 2020, WBCI reached out to us and let us know that they had received, I believe, 22 community grants totaling $198,000, and they just did not have enough fundraising dollars to cover all of that, and they wanted to know if we could partner with them to cover the rest. And we were very excited to jump at that opportunity because many of the grants aligned with the work that we were doing within the cancer program. So the first year we were able to support $100,000 to be used for those community grants. And this year we were able to support $125,000. So there is a whole section in the back of the year in review that talks about the work that those community grants reported for last year. And we look forward to hearing about all the projects that they're able to accomplish this next year. One of the really awesome partnerships that I wanted to highlight today is with Live Health, and it's a program called United in the Fight. So a partnership between Wyoming Breast Cancer Initiative and Live Health originally started providing mental health support for any woman in Wyoming who was recently diagnosed with breast cancer. And after the first year of that project, they reached out to say, we've had a tremendous need for this, but we also want to expand it to other topics. So breast cancer is the only one that WBCI can cover, but breast cancer isn't the only cancer diagnosed in Wyoming. And so we were able to partner with them to be able to fund mental health and case management support for anyone in Wyoming diagnosed with any type of cancer. And that project is going on its 4th year now. So we're very excited that we have had the support, and even with COVID and telehealth, it's actually increased the number of people that we're able to support with that. And then the last project that I wanted to kind of touch on related to the screening programs or at the Wyoming Cancer Program is the Radon program. We also revamped this from keeping in the past, we kept a stockpile of radon test kits at the office, and we would send them out to anyone that requested them. The problem with that is that they have an expiration date and they would expire faster than we could send them out. So we actually reached out to the laboratory directly to see if there was some kind of partnership that we could build with them, where we would just pay for a certain number of kits and they would send out fresh kits every time that there was a request. We piloted that, I believe, in 2020. And we started by giving out a coupon. So everyone, if they wanted to test, they would fill out this coupon with their name and address, send it in, and they would get a kit directly mailed to them. During that first year, Our return rate for radon test kits went from 40% to 93% just from that simple change. So we were very excited. This is just a little plug. Another thing that we're working on at the Department of Health is an app called the My 307 Wellness app. This app started as a pregnancy app where you could go in and track all the milestones during your pregnancy and then with your newborn baby, but it is expanded to include all types of chronic disease, tobacco cessation, HIV case management. So basically there's a ton of articles on there on any type of health topic that you could ask for. There's a weight tracker, diaper tracker, bottle tracker, exercise trackers, all types of things. And so if you have not already, I clicked too many times, sorry. If you've not already done so, definitely take a look and check out that app. It's free for I'm sure it's free for everybody, but we're promoting it mostly in Wyoming, and we hope that people in Wyoming take advantage of it. If you live in Colorado, you can probably still download it. There's not like a boundary turn off there. Okay. So up next, I would like to talk about the Wyoming Cancer Resource Services, or the WCRS. And so I would like for the WCRS contractors in the room to go ahead and stand and wave at everyone. All right, so we have Haley, Ellen, Cindy, and Kim. We do actually have 6 contractors technically throughout the state, and unfortunately, 2 of them are not able to make it today, but the ones that are here, hello and welcome. The WCRS provides services at the local level. And so there's the map of where they're located at. Whoa, sorry. Did you guys get whiplash for that? Okay, there's the next one. All right, so the WCRS mission is to reduce the number of people affected by cancer in Wyoming, which includes the following activities of promoting early detection and screenings, promoting resources within their local communities, and then utilizing resources within those communities to fill service gaps. Inside of this year in review is a lovely little recap of the projects that the WCRS were able to accomplish this last year. And so we're very proud of them. So although COVID was an interesting obstacle, they have still managed to complete several successful projects. If you have not already done so, reach out to your local WCRS contractor to see if there's any opportunities for collaboration and partnerships. So I just wanted to touch base a little bit on the projects that we highlighted in the year in review, and I'm going to try my best at just giving a general recap of it. And I'm sure that if you're interested in that type of project, you could talk to that WCRS for all the nitty-gritty details. So here in Region 1, which is located at Cheyenne Regional Medical Center. The contractor there worked with the large employer to add cancer screenings as a priority for their employee wellness benefit. So each employee can receive a discounted rate on their insurance premiums if they participate in certain health activities throughout the year. They must earn 10,000 points in order to be eligible for the discount, and they were able to add cancer screening as a 4,500 point activity. So that's almost 50% points if you just go complete one of the cancer activities. So this is a great way to encourage employees to prioritize their health. So in Region 2, which is located in Casper, and they serve Casper, Niobrara, Converse, Carbon, and Natrona counties. Let's see if I can get this. They partnered with a radiology facility and a genetic testing organization to create a breast cancer screening promotion. So during that month, women were encouraged to complete a free BRCA1 testing online and then schedule their mammogram appointment. Anyone completing a screening during that period of time was entered into a raffle basket or to receive a gift basket. And at the end of that promotion, the radiology facility reported that 25% increase in number of mammograms completed. So just that little incentive was enough to encourage people to complete their screening. And anyone that completed the BRCA1 assessment and ranked high was referred to additional testing. So Region 3 partnered with organizations in their area to implement cancer screening events on evenings or on the weekend, and a medical provider would come and complete clinical breast exams on the site and then would refer eligible women for a mammogram. A radiology facility and a WCRS contractor were on site to schedule appointments and then to enroll women in the screening program who needed financial assistance. In Region 4, which is the northern part of the state, so Hot Springs, Washakie, Park, Fremont, Bighorn. See, almost got them all. They partnered with a local organization to provide fit kits to patients in the area. So the local medical clinic mailed an informational letter to eligible clients, and anyone interested was assessed for eligibility, and then they were mailed a fit kit. If they completed a fit kit during that time period, they were also entered in to receive an incentive, a gift basket or something. To date, 75 patients had requested a fit kit, and 41 of those had been completed and returned. In Region 5, which is the southwest part of the state, Teton, Lincoln, Sublette, Uinta, Sweetwater, they partnered with a local employer to offer employee screening days. And during those events, employees were able to go receive a breast cancer screening without having to take time off from work or use their PTO. Any employee who completed a screening during that time was also entered into a drawing to receive a prize. There's a theme here. They also worked with several other organizations in their areas to do employee health fairs. And then Region 6, which is located on the Wind River Indian Reservation, primarily focused on supporting their local COVID response, but they were also able to partner with local food banks to provide food distribution to local residents. So congratulations on all that amazing work. Even though there was not a lot going on in your communities, you found unique opportunities to continue to increase cancer awareness and prevention activities. And then lastly, that brings me to the Wyoming Cancer Coalition, which is why you are all here today. So I have a couple of plugs. If you have not received or requested a copy of the cancer plan, definitely let us know. We have some here today. This is the 5-year cancer plan that we worked on. We just published this one March of last year. We did a whole launch on that, but if you were not part of the coalition at the time, you may not know what the cancer plan is. So I'll touch base on that here in a little bit. And then I also wanted to pass around these mailers that we just finished. They're getting ready to mail out this next month. So this was a part of Garrett's recruitment activity to try to encourage more participation in the coalition. So there are 5 different mailers. Oh, this one's old, not the right one. No, this is the right one. This is not the right one. Okay. So there is an HPV vaccine mailer that was going out to, I'm now struggling to remember, dental offices and dental hygienists throughout the state. There is a cancer survivor and mental health flyer that went out to all the cancer centers and then to all the mental health providers. There is, I have to read them. This one is a screening flyer. This one goes out to all primary care doctors, internal medicine, anybody that would potentially be providing screening services. This one is, forgive me. This one is healthy habits. So this one went out to all of the school teachers or principals and school nurses. This talks about creating healthy foundations in school settings. So talking about active living, healthy eating, sun safety, HPV vaccine, et cetera. Oh, sorry, that's this one. This one is the HPV vaccine. You'll see what they are when I pass them around. It's been a while since I reviewed them, but I'll start them here and you can just loop them around the tables, and these will be going out in the mail here in the next week or so. So if you are a provider, you may get one in your clinic. Okay. All right. So I think that's it. The last thing that I wanted to pitch was that most of you probably already received the YCC newsletter, but there is also a newsletter to sign up for to receive any cancer screening program updates. So any changes that we make to the screening programs, you can sign up here. These slides will be sent out so you can easily click on that link and register to receive those newsletters as well. Are there any questions about the work that we're doing at the state as the WCRS? Or how we support the coalition? Yes, Lisa. Okay.
My question, in the past, when we rolled out our new 5-year cancer plans, we did a press conference over at the Capitol, and we made sure that all of our legislators had a copy of the current plan. Are we doing anything this go around to at least get a copy of these into their hands? The actual plan.
We did bring copies. I didn't know how we were going to get them to the Capitol. And I thought we can touch base with you after that. We did not do a giant press release when we piloted it when we launched it in March of 2021, because we were in a full pandemic still, and we weren't having a legislative session in person. And so it would have been a little bit difficult. But since this legislative session is in person and currently going on, we have plenty of copies. So anyone that is able to lobby or go to legislative activities, you are definitely more than able to take some of those and do whatever you would like to do. However, those words were supposed to come out and they didn't come out, but I think you know what I meant. Sorry. Any other questions? I talk really fast, so we are probably ahead of schedule, but it looks like lunch is here. So that's great, because then we can eat and network, and then we will begin a new member